Hi everyone, my name is Allison Schroeder and I'm going to be discussing essential competency number 5. How can politics and legislation impact your clinical practice, and how can you impact these processes as a nurse? Politics and legislation can impact clinical practice directly and indirectly by affecting accessibility, affordability, equity, and social justice. I can impact these processes by having a better understanding of how they work, advocating for my patients by becoming politically competent, educating others on the importance of understanding and voting for people who advocate for positive change on these aspects, and attending policy meetings that are open to staff at the hospital I work at. During my RN to BSN educational journey, I was able to learn about how finances and reimbursements directly affect patients. This influenced the way I worked and charted. It also influenced the types of conversations I could initiate with management and supervisors. I am now able to ask questions about different systems in place and why they are in place. I've been working as a travel nurse, and at my current hospital, there's a very strong union. This union directly affects how healthcare, politics, and legislation within the hospital can work. The Kaiser Nursing Union in Northern California advocates for patient safety and nurses alike. Being able to have a strong voice advocates for both parties on a large level, and which initiates change at a much faster rate than compared to hospitals that are non-union. 2 courses from the RN to BSN course educational journey that has helped me achieve this essential competency were community and public health practicum and healthcare finance. During my practicum experience, my preceptor taught me about how financing for their facility worked. I learned that because of a limited budget, they had to pick and choose what they wanted to focus on. I also learned about approval rates and how they got approvals for projects. So they had to provide hard data and evidence for approval on bigger projects, which makes sense, but there's a big disconnect between the release of federal, state, and local data years down the road. So if you want a change now, it's probably not going to happen because you have to wait a few years for that data to come out to provide hard evidence to initiate change. So healthcare finance influenced the way I understood reimbursements, and it impacted my professional career as a nurse by being able to educate my fellow nurses, nursing students that I've had on things like chart audits and why they're done. And I recently realized that in staffing crisis, when we're really short-staffed in maybe JCO is coming, Joint Commission, and you have people asking you to chart things on your Epic charting system or whatever charting system that you have. And it's because based on these levels, these rates, the hospitals get reimbursements as these things are being done. So now I'm able to advocate for myself and for staff and patients because if these things aren't getting done, you shouldn't be charting them, and you should let people know that you don't have enough help to get these done. So thanks.